So I went out and sought the advice of the policy fellow Doug Badger of the Conservative Heritage Foundation. He's been a key advisor to the administration in the past. What was the president's healthcare vision for a second Trump term in the White House?
I think the approach is to provide people with the maximum number of choices in terms of how they receive healthcare coverage and how they receive healthcare being provided. So the Trump administration has been for different sorts of arrangements, the use of telemedicine, for example. They've advocated, in addition to the so-called Obamacare policies, other sorts of policies that don't necessarily conform to those rules and may be more affordable for individuals and families. So I think if you were to summarize what the Trump administration has tried to do, it's been to broaden the range of choices.
So choice is the Republican byword on this. If the system of choice that you currently have isn't, doesn't give you enough choice, I guess, how does it get improved?
Well, I think there are a variety of ways to do that. One of the things that's characterized the U.S. health system and distinguished it from others is that health coverage has, for basically the course of a century now, been based on your job. So if you have a job that offers health coverage, you can get the health benefits with that job. And when you lose that job, you lose it. That's probably not a great idea, but we have 170, 180 million people who get their coverage through employment, either as workers or dependents, and they're reluctant to relinquish that to a centralized government program or to some other arrangement with which they're unfamiliar. One of the things that the Trump administration has done, and it's gotten very little notice, is to allow employers to give a tax-free subsidy to their workers and then allow their workers to go out and choose a health insurance policy that they believe is best for themselves and for their families. My own view on this is that this has to be an evolutionary change. People aren't going to relinquish the coverage they have to the government or to anyone else, but they might respond to this sort of evolution where they own it and they're getting basically a tax-favored subsidy to buy it.
So Donald Trump has promised a new plan, but you're saying don't expect a revolutionary one ahead of the 2020 election.
I don't see it after the 2020 election. I mean, when you look at Vice President Biden's plan, it's basically more of the same. He would add what's called a public option, a sort of government-run insurance company that would be sold through the Obamacare exchanges along with all of the private plans. But he leaves the employment-based system intact. I think change on healthcare in the United States is more likely to come on an evolutionary basis rather than on a revolutionary basis.